his background of a cough. And so we had a look at his lungs on ultrasound. And this is what we found. See if that loads quickly. So this is the left side of his chest here. And as you can see, this is a nice example of what you were talking about, Jake, where we've got that consolidation, this tissue texture here with air bronchograms and some B lines. And behind it, we've got an even, we extended more posteriorly and found an even larger patch of consolidation there. And we've almost got that hepatization appearance here that you can see with this very complete loss of the pleural line there, tissue texture here, and these little air bronchograms throughout. This child went on to have a chest x-ray, and we can see that there is sort of pneumonia in this left lower zone with loss of the hemidiaphragm here, but it's certainly not quite as dramatic in appearance as the ultrasound was. And certainly if his child had just a chest x-ray alone, we might have thought that the area of consolidation was not nearly as big as what we saw on our ultrasound. Thankfully, this child actually did quite well, was clinically compensating quite well. His vital signs remained in the normal range. He had a dose of benpen in ED, did not require any supplemental oxygenation, and managed to eat and drink some food in ED, and so was ultimately discharged home by the PEDS team on high-dose oral amoxicillin. Next gentleman, this is more of a B-line images we're going to have a look at. 37-year-old, otherwise well man, presented with a 4-week history of fevers, headache, and cough. His GP had sent him for a CT brain, which was normal, but also a CT chest, which demonstrated subtle ground glass changes in the right upper lobe, suggestive of pneumonia. He was given a week of oral cefuroxime and was not doing any better. He came into ED tachycardic and hypoxic and had quite raised inflammatory markers. This was his chest x-ray in ED, which is pretty unexciting, really. And this is his lung ultrasound. So on the right upper zone, so this is the 1R segment, you can see we've got these lovely B lines, and this pleural line doesn't look lovely and normal and straight. And just as Jake was saying, there's irregularity of the pleural line suggestive of those possible subpleural consolidations. Go to the next slide. So this, we had a little look around more posteriorly at the right upper zone. Remember, these are taking a sec to load. And again, we've got that irregularity of the pleural line there, and some of those B lines floating down there. Just for comparison, this is the left side of his chest in the 1L area anteriorly, and we've just got a nice normal looking pleural line with A lines. So we had really localized focal B lines in that right upper zone. So he was admitted under respiratory, next on some Kefin azithro. His mycoplasma IgM came back positive, which is sort of consistent with that. If we're thinking that B lines represent interstitial inflammation, then that's pretty consistent with a mycoplasma pneumonia, where you tend to get that more interstitial inflammation rather than that alveolar consolidation. He did really well after a couple of days of azithromycin and went on home. Third one, little quick one. 75-year-old man, 5-day history of increasing shortness of breath and cough on a background of some cardiac issues and alcohol use. Had a low-grade fever in ED and did have a small oxygen requirement. He had raised inflammatory markers. This was his chest x-ray, and we can see there's a little bit of a pleural effusion and possibly some consolidation in that right side. Obviously, his heart looks a little bit abnormal there, and I actually, to be honest, can't recall whether I looked at his heart. I think I did. But it will focus on the lung for today. And as we can see here, that little tail of lung coming into view there, And the right side, he's got a small pleural effusion. I think our next, so I'm going to show you this one here. So we can more clearly see the tail of the lung within that pleural effusion there. And again, we've lost that pleural line. We've got that area of consolidation around the tail of that lung there and some air bronchograms underneath, consistent with a pneumonia with a parapneumonic effusion. He was admitted, had some IV antibiotics and remains on the ward at present. So those are just some little lung cases really demonstrating those things that Jake has taught us today, which I thought was really nice. Thank you, Jake, for that. Any comments, any more discussions about lung? Nope, we will move on. To Journal Club. Sorry.
Thanks. I just thought that it would be nice also to compile